Hello.
Governor, will kick off today's briefing with a question from Steve Alquist of Uprise RI. Representative Anastasia Williams sent you an open letter calling for more representation of communities of color on elected and selected bodies tasked with preparing communities for the impact of COVID-19 and future resurgences. Thoughts on this?
Yeah, I haven't seen the letter, but it's a good idea, so I'll have a look at it for sure.
Bill Bartholomew asks for the doctor. Are you and the Department of Health the primary voice that will determine whether Rhode Island can proceed with Phase 1 in May, or are economic factors being given equal weight?
It is a combination. Public health is a core driver to how we're moving forward. But it's important to understand public health includes society's economic health. If someone is going to remain healthy within their community, they need to have access to a job, they need to have access to finances to be able to obtain good nutrition. All of that plays a role. So we have a very thoughtful team and strategic approach that's driven by public health and absolutely takes into account the economic factors involved.
Sure.
I would like to address that for a minute as well. I think it's a very important question, and you see it playing out in Washington and all over the country in different states. So let me share with you a bit of detail about how it's happening. We have a team of people called a Community Mitigation Team, led by people at the Department of Health and in consultation with other epidemiologists and public health experts at Brown, Johns Hopkins, other places. They form the basis of the science and the recommendations. Then that group informs everything else. We have like a new normal working group and a school working group, and we rely completely and heavily on that. So I just think it's important that people know that. It's also important, you know, our guiding principle through this is there is a relationship between economic health and physical health. It is much harder to maintain your physical health if your economic health is so compromised. So while I will never do anything in aid of our economy that our public health experts think is dangerous, but it is also important to realize that there is a balance here. And when you have 170,000 people filing in our small state for unemployment insurance, that's a lot of economic pain, which could spill over into health suffering. And so, you know, it's a balance. I'm not going to say this is easy. This is a judgment call every day, and it's a balance. And together as a team, we're trying to do the right thing for Rhode Island.
Our next question is from Michelle Smith of the AP. The plan you released to reopen Rhode Island contains no specific testing benchmarks. Why? How many daily tests must be done, and what should the positivity rate be before it's safe to lift the stay-at-home order and reach the other phases?
So, a couple things. First, as I said yesterday was a high-level overview, an outline, if you will, because I just wanted to begin the discussion and give people time over the next 2 weeks to digest how we're thinking about it. We're going to be coming back with more details. Secondly, we think of it as what I said yesterday. We have to be doing enough tests so that every symptomatic person can get a test within 24 hours. So it's not that we're trying to do how many daily tests to be done. The answer to that, what we're trying to do is everyone who needs a test can get one within a day, period. Secondly, we want to make sure that we have an excellent system for testing everybody in communal living situations, nursing homes, DD homes, group homes, etc. So we have to have a mobile testing set of metrics. We're not quite there yet. We need to do that. The question left, so I forgot the rest of it. But the point is, you know, as it relates to contact tracing, we want to make sure we do the case investigation within 24 to 48 hours every time. So it's as much about speed and making sure the population is covered and no vulnerable communities are left out as it is around how many people per day. At least that's how we're thinking about it right now.
Barbara Morris from NBC 10 News has a question. Some medical offices have begun to offer antibody tests to the public. They say the tests are not FDA approved. What should the public know about these tests?
Thank you for that question. And with credit to the governor, that's one of the exact reasons why the COVID-19 Testing and Validation Task Force was activated. We have nationally and internationally renowned experts and scientists here in Rhode Island who are coming together to help get in front of the information being learned about antibody tests, and to be able to provide that information to the public, to the clinicians, and to businesses, so that we can all be best informed with which tests are the most accurate, how we should use them, and what approaches we should be taking with going forward. So we're thrilled, and thank you again to the co-chairs, Dr. Caliendo and Dr. Curtis, because that's exactly what this task force will be focused on providing for the public and for others throughout the state.
Our next question is from Alex Weldon of WPRO. Reportedly, the state assistance for hazard pay for nursing home employees making under $20 an hour is a loan. What are the terms, and how do cash-strapped nursing homes afford a loan versus a grant, especially when most don't have the money to advance for a week or month to meet payroll increases?
Good question. It is being structured as a loan, but it's a forgivable loan if the nursing homes use all of the money to augment the wages of their lowest paid employees. So the mechanism that we decided would be easiest to administer, and frankly the quickest way for us to get money into the hands of the hardworking people who need it, was to set it up as a loan. The nursing home or group home applies for the loan. They're advanced the cash. If the loan is spent in accordance with the regulations, and the primary regulation is that it all has to be spent to give raises of a certain amount to low-wage workers, then that loan will be forgivable.
Our next question is from Brian Crandall of NBC 10 News. What would you say to restaurant owners who don't know if their business can survive with significantly reducing seating capacity when they're finally able to reopen?
Yeah, so I would say my heart goes out to you, and we're going to do everything we can to get you through it. I'm hearing it, by the way, it's not just in Rhode Island. Restaurants across the country. It's a thin margin business, and being out of business for a month or two is not a small deal. So we're going to, having said that, I can't do something that I think is going to land Rhode Island back in the soup of a COVID surge. So we're going to be smart, and we're going to be effective. We're going to work with you, but we may need to give you additional support, and we're wide open to doing that. I'm very well aware of it, and we're going to listen to you the whole way through, and if that means figuring out special ways to support certain industries like restaurants that are especially hard hurt, then we're going to find a way to do that.
The next question is from Richard Asanoff of Convergence RI. This may be for Director Smiley. What plans are there for the state to switch from its COBOL-based legacy system to a cloud platform, as was recently done with the DLT's response to unemployment claims?
Thank you, Richard. Yes, the state's IT systems have been something we've been working on for a long time, and I'm glad that Richard brings up the point about DLT. One of the great successes in the midst of this terrible crisis was what the Department of Labor Training was able to do around the Pandemic Unemployment Assistance, the PUA program. And we were, as far as we can tell, the first or amongst the first in the country to be able to roll that out through a new system that was put together very quickly, although properly, and as a result of the strong team at DoIT, at the IT department. We're looking at other opportunities. Frankly, the only way we're able to have almost 2,300 state employees telework at the moment is because of some of the IT upgrades that we've made over the last couple of years. We have virtual call centers happening with state employees working from home. We have hundreds of devices out where people can VPN into their desktop, and so we've made great strides, but there's more work to be done, and we are looking for other opportunities to drag government into the 21st century, and this crisis has given us an opportunity to make some of those changes.
Thank you. Eli Sherman has the next question. Health Department data shows everyone who has been hospitalized is either still in the hospital or has been discharged. Does that mean that no deaths have happened in hospitals? And where are deaths happening otherwise besides nursing homes?
There have been a few deaths that have occurred in hospitals, unfortunately, but the number is small. What we are presenting with hospitalized data is currently hospitalized. Some of the unfortunate deaths from hospitals may be included in the cumulative total number of people ever hospitalized data. The places where deaths are otherwise happening is, in the locations where people are, whether the congregate setting or occasionally at home as well.
Our next question is for the Governor from Amanda Milkovits of the Boston Globe. Governor, you talk about possibly lifting the stay-at-home order, but there are refrigerated trucks at the medical examiners. Why are they there? Is this a contradiction?
Okay, I'm going to let her, but then it's addressed to me, so I'll come back.
As preparation for our response, we do have some refrigerated trucks at the medical examiners, not to be used right now because we have plenty of capacity at the medical examiners, but with credit to an excellent team that prepared for the surge, we have locations in place if needed for the future. Sometimes funeral homes may need additional assistance or other morgues and locations, and so that's in place to be prepared if needed. It is not being used, and it's all part of our overall preparation, reminding the governor's statement of prepare for the worst, but work for the best. So that's what we are doing.
No, I mean, that's exactly right. I would say, to answer Amanda's question, just because we may reopen the economy and lift the stay-at-home order doesn't mean people are going to stop getting sick. In fact, more people may get sick, but we have a healthcare system that is ready. We have a symptom tracking system and a contact tracing system. We now have places to live for people for free who are in quarantine, ways to isolate folks who are housing unstable. I mean, we will be living with this crisis, with this virus, with its sicknesses, with its hospitalizations for the next year. And we're all going to have to get comfortable with that. What we don't want to have happen again is an uncontrollable surge that overtakes our system. And I'm not going to let us go back to work until I'm confident that that won't happen. And we have systems in place that if we do start to see a surge, we know ahead of time and we can pull back appropriately.
This next question is from Ian Donis. Rhode Island has never had a person of color as a state Supreme Court justice. Will you commit to nominating a person of color for the pending vacancy?
I will not make that commitment, although I have a strong record of diversifying the judiciary in my tenure as governor, and I always will look at a highly qualified person of any race, of any gender, and I would encourage folks to apply. As you know, I pick from a list before me, and we've worked very hard to make sure that women and people of color apply, and I would love nothing more than to continue to diversify the court, including the Supreme Court.
Our next question is from Alan Gabberty of WBOB. What is the current status at the Rhode Island Veterans Home, and is there any plan to relocate positive or negative residents? How many residents have tested positive, and what are their ages? Have any been hospitalized? Continues on, how many residents are now in quarantine, and how many staff members have tested positive? And I can repeat these if you want.
Thank you. So we continue to have a very comprehensive and aggressive approach with our infection control and response at the vet's home, as we have been doing with our congregate care settings. A reminder is we had one patient identified as positive due to symptoms, and that led to the comprehensive approach that included, but was not limited to, testing all of the residents and all of the staff so that we could have a clear understanding of the landscape in that congregate care setting. So we have had 12 residents total who have tested positive. 11 of them do not have symptoms. There's only the initial one who was hospitalized, and that is out of 180 residents that are present. That allows us to better understand who has positive carriage, we say, who may have been exposed but is not demonstrating symptoms, and how we can care for them together. So our work is being done to help bring the people who have COVID-19 diagnosed through testing, even though they don't have symptoms, bring them together so that they can be cared for in one or a couple of units. We also have done the same for staff, and there are 11 direct care staff who are positive and 6 additional staff who are positives, for example, being housekeepers or folks who are doing important work to help ensure that the home is clean. So that information allows us to make sure that those staff are able to stay home and to isolate effectively there. And we can work very closely with the staff who remain to ensure all staff, which we had determined several weeks ago, continues to wear the masks that they need, continues to be socially distant as much as they can, and continues to have access to frequent hand washing and hand sanitizer to keep themselves and the patients they're caring for safe. We're also looking into ways to help ensure that staff persons stay to one area where they are. As I've talked about, one of the approaches in our congregate settings being limiting the different types of people that come in contact with the residents. So having this information in this environment allows us to do that more effectively.
And our last question today is from Patrick Anderson of the Providence Journal. The number of people tested has dipped in recent days. Do you know why that is, and whether it reflects fewer people experiencing symptoms?
We are not at the point of thinking yet that there are fewer people experiencing symptoms, but do anticipate that consideration in the future. Nonetheless, we want to continue with the expanded testing approach. When we are reporting test results, we are reporting the results, which is usually a day or two after the test has been obtained. And over the weekend, because of some challenging weather, there were fewer tests that were done on Sunday, which resulted yesterday, and that's what we are reporting today. So those types of changes can occur, but we want to continue the aggressive expanded testing strategy that I've been sharing and the governor has, including all of our high-risk populations that we'll continue to focus on.